Are you planning on getting a flu shot this year? What if your boss told you it was mandatory, and if you didn't get a jab, you'd likely lose your job? Well, that's exactly what one medical centre in Michigan told its employees. And now more businesses, especially in the healthcare sector, are following suit. It's just the latest chapter in the ongoing battle over the safety of various vaccines and whether or not forcing both adults and children to be vaccinated is treading on our civil liberties. Dr. Nancy Snyderman is NBC's chief medical editor, and Jami Floyd is a criminal defence attorney. Thank you for joining us this afternoon. Dr. Snyderman, you're a big supporter of vaccines.
I'm a pro-vaccination.
You always have been.
Yep.
Why would a company seek to enforce a mandatory rule on employees being vaccinated?
Because it wants its employee pool to be healthy. And at the bottom line is companies to make money. And when you show up and you can help the bottom line, it's great. When you call out and you're sick for 2 to 4 weeks, you infect other people, and there's a ripple effect, and companies can't afford it.
And that's particularly the case in the healthcare sector, because these are individuals dealing with patients.
It's even bigger in the healthcare sector. In the healthcare sector, if you're a doctor or a nurse, you have a real moral responsibility not to add to someone's disease burden. So if you decide not to be vaccinated and then you put a patient in harm's way, that to me is an egregious moral fault.
Jami, the Centers for Disease Control and Prevention for years has recommended health workers receive an annual influenza vaccine, but only about 62% of US healthcare workers take it. But from a legal standpoint, is there something wrong with enforcing this, in some way imposing a rule on employees?
Well, we are a country in which the individual has a right to his or her body. And the Constitution recognizes that right, the Fourth Amendment right to be free of unreasonable searches and seizures, our right to privacy. But all of that really goes to your right to be free from state interventions. Now, the courts have looked at this in terms of mandatory drug testing in the context of employers. And you are subject in certain contexts to mandatory drug testing. This is different, though. You use the word jab, and that's a very good way to put it, because this is actually introducing something to the body, which is quite different than asking you to, pardon the expression, urinate into a cup. Nancy's right, though. The employers, even state employers, have a right to think about the relative risks to not only patients but to other employees, and that's probably where the courts would go with this. It's a balancing test.
You know, I really find myself, as a former pediatrician and a surgeon and a mother, understanding that everyone wants to parent differently, and we all take the amount of information that's given us, and we have to weigh the pros and cons for our children. But as healthcare professionals, we enter a field wanting to do no harm. So in that role, if you don't want to get vaccinated, I think you have to think, are you perhaps not in the right job?
Well, one of the problems with this whole area is that somehow, despite all of the research that's been done, all of the evidence that's been produced, there are still questions about the effects of certain vaccines.
I think you can blame Andrew Wakefield for that, the renowned British physician who had fraudulent data published in The Lancet and started this idea that vaccines cause autism and that conventional wisdom has wiped out years of public good.
And that's a separate question also from your fundamental right not to be vaccinated or not to be subjected to certain testing in the workplace. You have a fundamental right there, but you don't have a fundamental right to then be a healthcare worker in those settings. There's no fundamental right to serve as a nurse or a doctor in those hospital settings, and then maybe you need to make a choice, as Nancy suggests, to do some other job.
So are you saying, finally, Nancy, that you think a healthcare provider, a company employing somebody, should enforce a rule like this?
Look, if you're a trucking company, I don't know what your rules are. But if you're a hospital, absolutely. The University of Pennsylvania was insistent last year. I believe they did the right, moral, and very courageous thing. The state of New York backed down, and I thought, frankly, they showed no moral fiber.
Dr. Nancy Snyderman, categoric and clear, and Jami Floyd, thank you very much for joining us.